All right, thank you very much for keeping it KBC. This is Good Morning Kenya. If you've just joined us, remember it's all about health this fine Tuesday morning. Now, a few months ago, actually in the month of May, 2 months ago, we had a discussion concerning one condition or disease that pertains to your body immune system. The disease is known as lupus. We gave that disease some definition. We talked about the signs and the symptoms. But this morning, we are going to take this discussion to the next level. We are talking about how caregivers can be affected by this disease. We shall talk about what are the reasons why you as a caregiver need to be there for your patient. What are the challenges you are yet to face? Because some of them don't have any idea what they are going to face. Some don't even know what next. Some don't know what to do. You've just received information, and now this is where you find yourself in. Well, this morning, we shall be putting this into perspective. They call it a disease with 1,000 faces. Some call it a disease of 1,000 faces. Some African cultures believe it is a curse. Well, this morning, I'm joined by, to my extreme left, I'm joined by David Miingi. She is a caregiver and a member of the Kenya Kidney and Lupus Foundation. Karibu sana.
Thank you.
And next to me, Jean Banda. She is the founder of Kenya Kidney and Lupus Foundation. And professionally, she is also a clinical nutritionist. Karibu sana, Jean.
Thank you, Ram.
Keep the hashtag going. Start tweeting. The hashtag is Good Morning Kenya on Twitter, at KBC Television, at Ram Aguko, at Jane Wambui. It's all about Good Morning Kenya right there, as you can see. Statistics show that the disease is 9 times as common in women as is in men, and more prevalent in younger people. This is where we shall be talking about. Remember, only 1 in 15 cases begin after the age of 50, and it tends to be less severe. And in rare cases, in very rare cases, lupus can affect children before the age of 5. As we talk about the challenges faced while taking care of patients, we shall start by putting into perspective, because experts actually suggested that one of the best pieces of advice that can be given to a caregiver is to develop an understanding of the disease first. Yeah. So as we talk about how caregivers are affected and the challenges they are going to face, and about awareness, experts say that they need to have an understanding of what the disease is, so that you are better prepared for the difficulties. So by definition, for the benefit of the viewer, we would like to start. What is lupus in your own way, and how has it been for you?
Okay. Lupus is an autoimmune condition. It's a disease that basically affects any part of the body. There are different types of lupus. There's systemic lupus, there's discoid lupus, and basically it is a severe disease. It is life-threatening at times, and apart from that, it comes with a lot of costs. But what exactly is lupus? This is a condition where the body fights itself, as I had said. For example, when you get a cut, to protect you from falling ill, your body is going to produce white blood cells. It's going to attack the bacteria, and you heal. But in the case of lupus, the body gets a false signal that it's in danger. So the white blood cells are basically produced in overflow. As a result, it may end up attacking other organs because it's in false alarm. It's fighting itself. Things are okay, but it gets the signal things are not fine, so we've got to fight. So
now it's like the body begins to fight against itself.
Precisely.
It's like a government fighting its own people.
Imagine.
Yeah, and for you, David, did you know what lupus is ever since you started, going to hospital, and then one day you just get the info that this is lupus? How was it for you, and how was it in terms of getting to understand what kind of disease am I dealing with?
Yeah, so to start with, it's a very difficult situation. Like she has mentioned, it's very devastating, and this devastation is not only the patient but also the caregiver, because in the first instance, this is it takes time to know that a patient or one is suffering from lupus. It manifests itself in very many different ways, Like if I recall, my wife went to hospital because of arthritis. Diagnosed with arthritis in the first instance. Later on, she's suffering from the heart. Later on, she's suffering from skin rashes. And for all this time, no one could identify and say that this is lupus. All they knew she,
for how long? How long?
For about 2 years, she went to hospital for various things, various organs of the body who had problems.
But now here we have a scenario where you go to hospital, you are told this is arthritis, this is this is that, but it's not it. It means you end up having expenses that are not necessary.
Very expensive, and also you get confused because this month the patient is suffering from lupus. The other time she's in hospital because of the kidney. The other time she's in hospital because the heart is enlarged.
Wow.
So until it is diagnosed and say that this is lupus, that's the time you know now. This is the situation, but at the same time, this is a situation you have never heard of. This is a disease you have never heard of. Lupus during those days was so strange. 38 years ago, very few doctors had ever treated the case lupus. You could not rarely find lupus patients in hospital. For example, if I recall, she was in Aga Khan, there was no other patient with lupus. She was at Mpishan, no one else with lupus. Kenyatta, no one else with the lupus. Until I got a doctor who said, I've treated such cases in Britain. And I think this is what I saw in Britain.
And this is where the name, where some people call it the disease with 1,000 faces.
With 1,000 faces, because today is the heart and lunch. Tomorrow is the kidney. The other day you have no hair. Your hair is gone.
Wow.
So the other time you are suffering from the eyes. You know, various organs of the body get affected.
What was your first instance or the first encounter that you had with lupus?
Of course, as he says, there's a lot of misdiagnosis. In my case, they thought probably I was stressed because actually there were no direct signs.
You were diagnosed with lupus?
Yes, in the year 2000. So at first, diagnosis. In my case, they thought probably I was stressed because actually there were no direct signs.
You were diagnosed with lupus?
Yes, in the year 2000. So at first, they thought it was stress. Then when my joints started aching, they said it's arthritis. I was actually on medication for arthritis. And before we knew what was happening, my kidneys had been attacked. So it was a shocker because here I am trying to figure out what arthritis is. The next thing I'm hearing is, you have kidney failure. All along, we still hadn't been told about lupus. So it's much later that we got to know about the lupus bit.
How long did it take till you discovered?
The same year. This was in the year 2000, yes.
The year 2000. Therefore, you took 2 years.
For me, it took about years because she started falling sick in 1982, and it was not until 1983 that a doctor told me this is lupus. And for him to know that it was lupus, he had to send samples in Britain, then he sent other samples in Germany, other in South Africa, so that he could get different opinions. And all of them came with lupus. And then that's when he started the journey of lupus, 1983.
Now let's talk about this journey.
Yes.
How has it been since you started? And we will also get to Eugene. How has the journey been for you since 2001?
2000.
Since 2000 and since 1983.
Yes.
How has it been for the both of you? I will start with you, David.
It has been a very difficult journey. One, you are dealing with a strange disease. Two, you talk about it and nobody understands what you are saying. You talk of lupus and then there are so many questions. What is this lupus? We have never heard about it.
Some believe it's a curse.
So finally you stop talking about lupus and start now you talk of the specific area where she is now suffering. No, she has a heart condition. If the heart is already well settled and stable, you talk about the kidney, you talk about the skin, you talk about what the person is seeing. And it was difficult, particularly it's difficult because, for example, here, your spouse becomes sick, children are young, you are taking care of them, you are taking care of the patient, you have to manage the patient, you have to do certain things, manage the medication, and at the same time encourage her Because in many cases, like Jean has mentioned, you tend to get depressed, to be stressed, because you don't know what you're suffering from. Like I recall one time she had a deep wound on one of the legs, arising from, there was something they call deep vein thrombosis, and it was coming out with some watery things. A wound is here. Then along the way, as you take the medicine, the hair is gone down. You look at yourself, and I'm sure it developed some kind of inferiority complex and some low esteem, such that you may not even want to go out in some cases, particularly when you are young.
What was the lowest point that you got since you started dealing with this and taking care of your wife who is suffering from lupus?
The lowest point, I think, was 1986 or so, when she was in the intensive care unit at Aga Khan Hospital.
Wow.
Disoriented. She also had clinical malaria. And that was one of the periods that things were so down for me. I recall one time a colleague at work went at noon. I went to see her at lunch hour. Another one followed. And at around 4 or 5 o'clock, some people also saw her. And those who saw her at noon brought bad reports to others. Oh, she's very sick. She's not coordinating. Then the issue,
bad reports, she's not sick.
Distortion of information. Then it reached me at around 8 o'clock that your wife is gone. You have lost your wife.
Yes,
because of the same distortion of information. Distortion. Then finally somebody, we let her so bad, the other one, blah, blah, blah. And then lastly, somebody came to me, Paul Lesana, for what has happened. What is it? We have been told this and this. So I had to go and ring Aga Khan Hospital. How is my patient? I was there at 1 o'clock, and how is she doing now? No, she's fine, I've been there. Can you go and see her? I have seen her, I'm telling you, the sister in charge tells me that she's okay. So I think that was the lowest point in my life.
Believing that she's gone, yet she is still there.
She is still there, because of distortion of information from those who had visited her.
And it's quite sad, because it takes a toll on you.
Very, very, very sad.
Jean?
Yes.
What is your lowest point?
My lowest point was when I realized that there's actually no cure for lupus. I wasn't sure I would be able to deal with it, because if there's no cure, what next? Does it mean I'm here for the shortest possible time? At the time, my son was very young, and I was wondering, will he live to see me? Will he have a mother?
How old was he?
He was 6 years old.
6 years.
Now he's 24.
Wow.
And working, yes. So it's all by God's grace.
Congratulations.
Thank you. Thank you. Yeah, it's all by God's grace that I've been there through all these. And actually, when I went for his graduation, that was the best part of my life. I said, thank you, God. I never thought.
You believed you were going to die?
When there's no cure, it's something nobody knows about. You're talking to people and they're all like, what is that? And when they come, they tell you, oh, I heard that it's a very bad thing. Do you know so-and-so? We've actually lost them. Do you know this? Oh, and you've gotten kidney failure? Oh, that in itself makes you scared. And you're like, okay, I think I need to get prepared. And
in both the scenarios, there's this aspect of how outsiders affect your emotion. What they say outside there, they come with reports, oh, this person is no longer there. You will also experience the same. They go Google, they do this, they get information, they do their own research, and then they give it to you.
Precisely.
So seemingly we have a problem of how other people interpret lupus for us and define it for us.
Yeah, and it puts you down, because most of the time there's nothing positive. So the thing I would tell lupus patients is stick to the doctors, adhere to the medication, live positively, join a support group, because it is only within a support group that you're going to be able to find people who are like-minded. And also family members. The way David has been supportive, it's important for all the other people that have patients. It doesn't have to be lupus, it doesn't have to be kidney, even if it is cancer, whatever chronic or long-term illness there is, that social support is very, very important. Actually, I am here today because I got social support, not only from my immediate family, but even from the extended family. And I think it really helps. And people should stop stigmatizing conditions.
And here we have a problem now, stigmatization of lupus patients and stigmatization of lupus as as a disease, as a condition there. Because now once they hear lupus, they know, question marks are put there. ICU,
yes.
Question marks are put there. No treatment, question marks are put there. How is it for you in terms of stigmatization now, relaying the information to other people, family, friends? And the question will come, does even your son know that you have lupus? It can be sensitive to some point because it affects you as an individual. How was it in terms of stigmatization from other people and how other people received you?
Stigmatization is always there, and like she has mentioned, in most cases, nothing positive usually comes from people. They look at the situation in their own ways, in their own views. Some may think it is a curse, like you mentioned. Some may think that this is an incurable disease that doesn't deserve going to hospital, and is a disease that emanates from maybe witchcraft or something like that. And you'll even hear people suggesting that you go and see such and such a muganga somewhere in some areas.
Do you believe that?
Oh, for me, I never believed that, and because I had a very qualified doctor, Professor William Lore. I always like mentioning him, and with the samples gone to Germany, South Africa, and England, I would not have thought of otherwise, and I would not have had a different opinion from him. But for others, because as you try to explain, nobody really wants to listen. Although at the same time, even with this stigmatization, there is also a lot of social support from those who understand, because you've got friends that are with you all the time.
Did you have people who rejected you?
Well,
did they come at any point? Did everyone accept you?
Not so, but you could always hear whispers, which were not pleasant. And I would rather dwell on the positives, because I've received a lot of social support from friends, from the neighborhood, from the church fraternity, from family members. But at the same time, there are those others with the negative views. And sometimes you concentrate on negatives, you also get stressed. But it is actually there. Because when somebody says, this is not a hospital case, let's go to Kisii, let's go to Kitui, let's go to Mombasa, Kilifi, to see a muganga, then you see there is quite a lot. But because you don't want to concentrate on the negatives, it has a lot of side effects. So you have to learn. When you have such a long-lasting case, life-threatening case, you will better concentrate on the positive. Because they are there. You've got social support groups in the community that are positive and are ready to assist emotionally, psychologically, and even materially, because, like she mentioned, is a costly disease to manage.
And we will talk about that. But when it comes to the aspect of social issues, stigmatization, how was it for you? And did you have the experience of feeling that at some point, or thinking or suspecting that at some point you might not be accepted the way you used to be, but now this is how you are and this is how it is?
For me, yes, because of the whispers, and I realized everybody can be a doctor.
Yes.
Everybody can be a doctor.
They all had their diagnosis. Some were coming to see, because I can tell you, I was like 48 kilos. And with my height, you know what 48 kilograms is? Yes.
And how much did you weigh?
Prior to that, I was 64.
64. So
yes.
It dropped from 64
to 48.
48.
I could actually wear some of my 6-year-old son's clothes. It was that bad. And everybody was a doctor, so they would come, and some were actually just not coming to encourage me, but just to see, And as a patient, you become very sensitive, and you can tell who's come to support you and who has come
just to see
but
what they are hearing.
To see
Yeah, that was the question. It reached a point where I said, I don't want any more visitors. My late mom was very social, and she would still bring people, and this would anger me, I wanted to be isolated. I didn't want people, and before any visitor could come, they realized they would have to ask me first, because I didn't want anything that was going to dampen my spirit, yet I was here trying to fight my way back to health.
But now here is a problem of isolation. You wanting to be alone and rejecting, you know, the people who come close to you. Did you have the same experience with your wife?
Yes, Mr. Ramanda, I would wish those people out there who have patience to hear what you are saying and change their thoughts, their mind. Because like she's saying, I recall a time my wife was so emaciated. From a lady who was around over 60 kgs and walking very strongly, coming down to around 40-something kgs. At the same time, she had ulcers in the mouth, she had lashes in the body, she has wounds on her legs. At the same time, she had lost her hair, and her hair was as good as this, but at that time, the hair was bald. And this is why, like she says, a patient may feel like not wanting to see a visitor. A patient may feel living alone in the house. Because at the same time, she has a mirror, and she sees also how she is. I recall at one time, the doctor had to prescribe some medicine for stress, to relieve the stress, because that kind of thing. And for you as a caregiver, you also feel down. Because at that time, the patient somehow, if you're not careful, may lose hope. Because I recall at one time when it was so bad, my wife told me, no, I don't see the need for taking medicine. I've taken this medicine for about 2-3 years now. I don't see any improvement. The situation is worsening. I'm now out of the classroom. I'm not teaching. I'm out I've been out on half pay. 3 months. I'm now out of work over 6 months. Surely, you know, one tends to lose hope if you're not careful.
But now,
as a caregiver.
As a caregiver, now, how do you come in there? Someone has lost hope. Someone doesn't want people. They don't want the drugs. They just want. They feel like no one should be around them. How do you come in?
Mr. Rami, I've come in and encourage the patient. And this is missed in some cases. I know of certain cases where somebody is suffering because the caregiver or is also, you know, is also feeling that as if this is not the real diagnosis. This is not lupus. What is it?
There is something else.
Yeah, there could be something else. And I've seen some people actually neglecting a situation. Only to find later on, because the patient, you know, the patient goes looking out for support, social support elsewhere, and finally, there could be something else. And I've seen some people actually neglecting a situation, only to find later on, because the patient, you know, the patient goes looking out for support, social support elsewhere, and finally comes out stronger, goes to hospital. I recall of a lady going to India after being neglected, even by the relatives. Each relative says that now we want a second opinion. Then the other ones, we want another one, we want another opinion. What is this lupus? I've never heard of it. Maybe there is something again being employed by the patient, the doctors, which is actually wrong, you see.
I am aware that...
If I to finish up, if you as a caregiver listen to those negatives and accept them, then there is that the patient is left with no one to seek support from.
Because you are the pillar of the patient.
Yes.
Now once the patient loses you,
then that's all. And for example, in my case, after describing, you know, those early years were so bad because the disease is usually severe when you are below 45. At 45, sometimes it goes into something doctors call remission. And disappears, hibernates in the body.
Is that true? You've dealt with it. Have you seen that happening?
Yeah, it is very true. But in order for you to get to that remission, you must also adhere to the doctor's instruction. Because as is mentioned, people keep looking for a solution, for the cure. Who wants to be on lifelong medication? It's affecting your life. It's cramping up your style. So you find that people discard the medication. People start going for herbs. People go for all these new products on the shelf that promise there'll be no side effects and you're going to get cured. And acceptance becomes very important. One needs to accept that this is what has happened. I will have to live with this condition for the rest of my life. Not every day is going to be the same. There are times there are ups, there are times they are down. Yeah, so I think the important thing is for the patients to struggle to move on so that they get to that age where the disease is going to be mild. So it's a journey, it's a battle. They must fight on so that they get to that point where the symptoms will be very subtle.
Back to you. So you're saying now you reach 45, huh?
Yes. And when you reach that age, if you're lucky enough, it goes to the revision. But one, you have to continue managing the organs that were destroyed during that, during the time that the disease was so severe. So like in my wife, the organs that were destroyed, one was the heart. So she has to live with medication throughout her life. Medication to support the heart. Number two, the blood system was also destroyed by the disease. She has to live on blood thinners to ensure that the blood is not either too thick or too. Because at one time, even while still in the disease was in remission, 8 years ago, somehow the drug failed. She was taking a drug called warfarin, and when it failed, there was a clot that moved all the way to the...
The doctor said that the drugs failed.
Yes.
They did they have an explanation?
For reasons I really don't know, but it failed and the clot. But you know, she had taken the drug from 1983. So I don't know, maybe...
What of a sudden?
There could be medical reasons. The clot went in the hand. However, we also still praise the God because the clot would have gone to the heart. And the professor had always told me, even those early in mid-80s, there were times that the clot went in the lungs, but the doctor was able to dissolve the clot. There was a time the clot was in the veins in the legs. So he always told me to keep my fingers closed because the clot could go to the heart anytime. But that has never happened. It then went up there. So she fell down with a stroke. So I have now been managing the stroke from 2011, which has also been very difficult, not easy. So I would wish those out there with the patients. And I was wondering, I was thinking that one of these days we could start an association for caregivers. Because there are also cancer patients who need caregivers. There are also the diseases other than lupus, where caregivers could be also go down with the depression and stress. And possibly we need to come up with one where
we need to have such kind of organizations.
I'm thinking we should.
Specifically for caregivers.
Yes, for caregivers, yes.
Because they are also affected.
Oh, in a big way. In a big way.
And we'll come to that because at some point it will always take a toll on you as a caregiver.
Yes,
it will take something emotionally, psychologically, everything. You will lose everything.
Yeah, so we need to have some associations of some kind. And
Jean, I'm aware it affected your kidney. And I would like to you to tell us how it was since then, and the acceptance rate for you as a person.
As a person, I would say initially, in the first year, I was traumatized, I was shocked. I just didn't know what was going on. And a lot of information was being withheld because my family didn't know how I was going to take it. And they didn't want to shock me. They wanted to encourage me to carry on. That's where the social support comes in. At an individual level, because of all this support, and that's why I urge everyone out there, if you have a patient, please support them. Because of this support, I was able to pick up and carry on. And thereafter, I became very positive. I must attribute it to the social support.
Yeah, I think you should tell them right there again. If you have a patient, what should they do again?
If you have a patient, make sure you're there for them. Be supportive. If it was not for social support, I would not be there. Do whatever you think is best to enable this patient, carry on and live positively.
Wow. That is a very powerful one. Remember, it's all about lupus this morning. Keep tweeting. The hashtag is Good Morning Kenya on Twitter. Tag me at Ram Aguko. Officially, our handle is at KBC Television. The hashtag is Good Morning Kenya. Send us your comments, your tweets, your questions, and your thoughts concerning this discussion that we are talking about this morning. Lupus. I would like us to talk about the challenges you face as caregivers, how it is for you. And we can start by talking about, now that you have a patient and you've gone home, the first thing, because you have the drugs, the first thing that will come into your mind, I don't know if it happens to me, but the first thing that will come into mind is you will think of the food that you should give to them, because here you have drugs, lazima ameze dawa, na pia lazima akule. How is it when it comes to taking care of a lupus patient and ensuring that they have a proper diet? You are a professional when it comes to nutrition. Yes.
Okay. Let me start from the general. Generally, any patient needs to eat well. They must have a balanced diet. And for some conditions, there are foods that they're going to have to steer clear of. In the case of lupus, you find that there are people who react to wheat. Not everybody, but some of them are going to react to wheat. In that case, the diet must not have any wheat products. You'll find that arthritis is one of the correlated conditions affecting lupus patients. Many a times when they take red meat, you'll find that they react. The joints start aching, they're not able to get out of bed. In that case, then, they will have to avoid red meat. And I must say, it is not a blanket cover. Some people will react to meat, some are not going to react.
So it depends on
It depends. It has to be individualized. That diet has to be individualized. Number two, why must it be individualized? There's some that have organ involvement. If the heart is involved, we're going to have to look at things like the fats. What are they taking? If the kidney is involved, there's going to be a lot of restrictions.
Now, these are tips for caregivers,
Yeah, there's no blanket cover. That's why it is very, very important to seek professional advice.
And for you, how is it now when it comes to feeding your wife?
Like she has mentioned, and like we have mentioned before, lupus manifests itself in different ways in different people.
Okay.
Because different organs are affected.
Yes, that's right.
For the same reason, the best thing is to follow the advice from the nutritionist and also from the doctors on how the patient has to feed. Because if there is this part of the organ is suffering or the other, the doctor may relate the diet with what organs of the body are affected.
But you know, Mr. Mwingi, when you started taking care of your patient, you did not have any idea what you're doing. Did you have a nutritionist who was on standby to advise you not to do? Did you know what you're getting yourself into when it comes to now feeding?
Oh, first days, Mr. Ahmed was meandering here up and down because we didn't know anything about what is happening. So the question of the diet and other things came long after. The doctor now knew that this is lupus, and there had to be certain restrictions. This is the diet. Do not burn yourself in the sun. It will increase the lashes in the body. But
you did not know anything of
2 years,
none of these things.
You are just in the dark. Yourself and the patient. All you needed to do is to ensure that she gets the right diet because she is a patient. And you naturally you know that there is need for a balanced diet. But after that, you now had to follow the instructions. And the other challenge is that you must ensure that the right food is on the table. You must ensure that the other challenge must ensure that the drugs are there. And I'm saying that because there are many other people suffering out here. For example, like now I may say that our medication is at its lowest, but if I mention the cost per month, it is still a big amount of money. But there are people out there in the counties who cannot afford what we are supposed to give to the patients.
And you'll tell us how.
And the patient must eat like you mentioned. So out there, for somebody who has no earnings, somebody who is waiting for maize and beans to grow so that he can sell 2 or 3 kilos of maize to get the medicine, is not easy. And this is why sometimes we have thought that this awareness should even go down to the counties, to the hospitals, where it is taking long us to diagnose, like we have mentioned. In our cases, it took time for me, it took time for her. It must be taking us the same period of time down there.
How high can it go?
How high it can go?
Yeah.
In what context?
The cost. Yes.
Oh. It can go to as much as possible. 20, 30, 40, 50,000 shillings. I recall the first time after my wife left hospital, after being affected by the stroke, the costs were close to 50,000 shillings per month. You need a physiotherapist, you need the medication for the heart, medication for the blood, and a lot of other accessories. It's not easy.
And for you, how was it for you in terms of the costs?
Medical costs are high. Just like for any other ailment, it's equally expensive for lupus. And in the case where organ involvement is there, it becomes worse because you see immunosuppression drugs are not cheap. So it could even go to twice as much of what David is talking about.
Over 100.
It could reach there. So many a times you find that patients skip medication not because they want to, but because they cannot afford. Sometimes you'll find they decide they'll do the underdose, because if you're supposed to take a tablet today, maybe that tablet is 400 shillings. They feel maybe if I take half of it, I can still have some for tomorrow. So it's a dire situation. It is very saddening. And that's why when NHI said they're going to increase the premiums for chronic patients, it was a major concern amongst our members. Because if you have to pay for a year in advance to get any kind of treatment, I think it's unfair. I think it's like marginalizing the patients, and it just makes them lose hope, because these are expenses that are not easy for any single person to afford. And if that is done, it will be out of reach for many people, because this is way above what many people, especially in the counties, can afford.
Now, so you have to take your drugs, you have to buy them, you have to buy the food. Mr. Mingi, when before you knew that nutrition was of importance, what were you feeding your wife? What kind of food are you giving her in terms of the diet that we're talking about here?
I had to ensure that,
that is before you knew.
Long before I knew, I had to ensure that, like we have learned over years in schools, you need vegetables, you need fruits.
Oh, so just the basics then.
The basic, yeah, the basic, because I couldn't go for anything else until the restrictions were don't eat this. Ensure that you have boiled your meat, don't eat this kind of meat.
And it's normally trial and error for many people. Yeah, because everybody will give you some advice. When you're unwell, people tell you eat a lot of fruits, drink a lot of water. But
just take fruits and drink a lot of water.
And it's normally trial and error for many people. Yeah, because everybody will give you some advice. When you're unwell, people tell you eat a lot of fruits, drink a lot of water. But
just take fruits and drink a lot of water.
Exactly, and vegetables. But now, the danger of that is this. If it is with kidney failure, one of the functions of the kidney is to excrete excess water and to excrete some of the minerals like potassium. Now, if the kidney is affected, it cannot do that. Many fruits are rich in potassium. So if you're taking a lot of water, you're not able to remove it from your body. You're taking a lot of fruits and vegetables, which are high in potassium. What will happen is you're actually killing this patient, because potassium can actually cause cardiac arrest in a patient whose kidneys have been affected.
So me taking a lot of fruits and veggies does not necessarily mean that I'm having a healthy diet.
No, you are having a healthy diet because your organs are working, okay? But when it's a kidney patient, then the kidney is not able to control all these. Like water, when you drink water, you're going to go to the loo and pee, right? When a kidney patient takes water, they're not able to pee, okay? So when they take the water, their body is going to swell. It will go on even up to the lungs. The heart will be affected. The breathing will be slow. And that's why you find they'll be told the next mode of treatment is dialysis. Okay? Now, the dialysis machine picks up the functions of the kidneys. So that's why I was saying there's no blanket cover. Each patient must have their diet individualized.
I'm aware you're working with the Ministry of Health when it comes to a program, scaling up nutrition. Yeah, maybe you can tell us something about that.
Yes. Actually, it was just about a month ago when I was chosen to be a champion with the Scaling Up Nutrition, where we're supposed to create awareness, and it's part of the Agenda 4 on food security. So even Ministry of Agriculture is going to come in for that. So in this, we always want to find out, what are you eating? Is our population aware? There's a lot of food nowadays. It's being grown, even in places we cannot talk about. So we need to take our health into our hands, because some of these diseases we bring onto ourselves. Where has your vegetable been grown? You know, when you want to buy those green leafy vegetables, the leaves are just too big. They normally say they could have been grown along a sewer. So why do you want to go for these excessively big green leaves when it is not normal? So we have, our health is in our hands. We now have to start taking charge so that we avoid all these lifestyle conditions. So the first question is, where is my food coming from? Is it healthy? What about the preservatives? Do I really need to take that kind of food? So actually, it's in line with food security and healthy nutrition.
As we bring this discussion to a close here, I would like you to have your final word and tell us, speak to the Kenyans outside there, speak to your fellow caregivers as you end up in the next 1 minute.
Yes, I would like to start a bit, digress a bit, and start with the diagnosis of lupus, and request the Ministry of Health to ensure that there are guidelines all over the county hospitals and in health facilities, because we have qualified doctors, but why it takes a year or two to diagnose the disease is actually a problem. Something needs to be done. Some guidelines need to be sent to the county hospitals so that the doctors and clinic officers will always set those guidelines when they see something recurring, the heart the problem is recurring, there is a kidney problem, there is skin problem, so that they at least know how to, their system. They are qualified, but there needs to be something like that. And for the caregivers, my word is that when you realize that your patient has lupus or any other chronic disease, ensure that you encourage the patient, be it the wife, be it the husband, and ensure that your wants, your way of thinking and your way of looking at the patient is always positive. Have encouraging ones, and because the moment you lose hope yourself, the moment you become discouraged, even if you're not saying it, it will reject. The negativity will reject itself, your facial expressions will reject, and the patient will also be discouraged, which will be fatal as far as the disease, the patient is concerned. All right.
Jean, have a final word. Speak to the Kenyans there. 1 minute.
All right. I'd like to encourage the patients. Try and join a support group. Try and educate yourself. Knowledge is very important. When you have a condition, it is in order for you to find out as much as you can about it. Know what to eat. Know that you have to adhere to the treatment. At the same time, I'd like to encourage the caregivers. It is not easy. It is tough. And hopefully in the future, as David said, there will be something that takes care of the caregivers as well. At the national level, if there are chronic conditions that have been covered, we hope that the lupus disease is also going to be fully covered, so that these patients who have high bills are also catered for with the NHIF.
All right, thank you very much. That is Jean Banda. She is the founder of Kenya Kidney and the Lupus Foundation, professionally a clinical nutritionist, and David Mengi, a caregiver. Thank you very much for joining me, and I wish you the best even as you try to take this awareness to the next level. This is Good Morning Kenya. The hashtag is Good Morning Kenya on Twitter at KBC Television. I believe that it has been a helpful discussion, even as we talk about awareness when it comes to lupus patients. Tweet us at KBC Television. My handle is at Ramaguko. My colleagues at Jane Wambui and at Ray Manyara. This brings us to the end of this show. I believe that you have had quite a lot when it comes to information. Remember, keep it Good Morning Kenya and keep it KBC Channel 1. May God bless you and may God bless the work of your hands. Now up next, it's all about creating awareness when it comes to cancer burden. This is a feature, and I hope that you will learn something from this.